Whenever there is liver failure, whether it is acute liver failure because of toxins or it is chronic liver failure because of alcohol or viral infection, mostly it can be because of fatty liver disease, which is rampant in our society nowadays, and it leads to cirrhosis if it is not controlled in the early stages. All these conditions lead to liver failure, and since we do not have something like dialysis as we have for the kidney, liver transplant is required as a life-saving procedure. In our country, liver donation is very poor from brain dead people. That is why we rely mostly on living donation. Now, what is living donation and how we can take liver from a living donor where there is only single liver? That is because the liver has got two parts, the left and the right, and liver has a unique property of regeneration. And we only need 30% of a normal liver for sustaining our life. These are the three important things by which a person can donate a portion of their liver. So who can donate? According to the Human Organ Transplantation Act, anyone who is related can donate the liver, and medically we take liver from only those people who are adult, that is they should be above 18 years of age, and those should be less than 55 years of age. That is because elderly patients, if they go for donation, the risk of surgery is high. So the donors should be blood group matching mostly. If there is a blood group compatible donor in the family who is between 18 to 55 years of age, they can donate a portion of the liver once we have done adequate investigations to find out that the liver functions are normal and the portion of the liver which we want to take is adequate for the patient, and the remaining liver which is remaining behind in the donor is adequate for the donor. The other important thing is that once the liver is put in the patient and the remaining liver in the donor, both the places the liver regenerates and comes back to the normal size within a matter of 3 months. Initial 2 weeks, the regeneration is very fast and it attains about 70 to 80% of their normal size. The functioning is immediate. So the moment the new liver is put in the patient, the liver starts kicking in. And similarly, the remaining liver in the donor continues to function. So these are the important factors by which a living donor can donate a portion of their liver. Living donation is important in our country because we do not have many disease donations in our country, and we have more than 25,000 liver recipients waiting on the list, and we do not have adequate donations. So most of the transplants which are done, they are basically dependent on living donors. It is a very safe surgery, and for the last 2 decades this surgery is happening in our country. In Max Institute of Liver and Biliary Sciences, we have operated on more than 3,500 liver patients, and most of them they have had living donor liver transplants. That is because we lack disease donation. I can assure that with this expertise, this surgery is very safe in our institute, and living donor can give a life to their loved ones.